very good afternoon, colleagues, ladies and gentlemen. Firstly, I'd like to thank the organizing committee for having me on board for today's session. For those of you who don't know me, I have the privilege of working with Dr. Stephen Chen and Shane Kellis. And at our practice, I have access to a cone beam CT machine. And I chose this topic because I wanted to share a little bit about my experience in the learning that I've had with the benefits and limitations, specifically regarding diagnosis and treatment planning. So just briefly, we're going to go through what CBCT is, the indications for CBCT, the accuracy that is reported in literature, the general benefits and limitations, and then we'll look at some cases to illustrate these points. Now, I'm not a radiologist, I'm a periodontist, so this is really my perspective. What is cone beam CT? It is a divergent pyramidal or cone-shaped source of radiation. So here we have a patient who is about to be irradiated, and that's the region of interest that we're interested in. We have a source, and the detector and the source rotate synchronously around a fixed fulcrum. The big difference between CBCT and the conventional multi-slice CT is in the shape of the beam. However, there are of course differences in the detectors, but we will not be covering that today. The indications for use of CBCT, the majority of us here today will have had to use the CBCT to look at the position of important anatomical structures, the sinus, the nerve, to assess the bone volume for correct three-dimensional implant placement. For endodontic diagnosis, this is particularly useful. Assessment of impacted teeth, other pathology, trauma, orthodontics, and the analysis of TMJ.